My name is Dosunmu Jubril. I'm the Medical Director of Southern Shore Hospitals. And today we'll be talking about malaria. Malaria is a parasitic infection and it's one of the deadliest infections out there today. The mortality rate is quite high if not appropriately managed. As of the year 2019, 400,000 people were known to be dying of malaria yearly. So that is obviously a huge number, which of course the WHO and other health organizations are trying to reduce with a large amount of resources. In Nigeria, the most prevalent species of malaria is malaria which comes from Plasmodium falciparum. And of course, in other regions, other tropical regions, we have other species of malaria. But today we're going to be talking about malaria from Plasmodium falciparum. But the first thing we need to talk about is how do you get malaria? And malaria is normally passed from one person to another through an infected insect, which is normally a mosquito, a female Anopheles mosquito. Now, people in Nigeria would say that, oh, I went out somewhere and I was bitten by a mosquito and I want to treat malaria. That is absolutely the wrong practice, because for you to get malaria, you must have been bitten by an infected mosquito, not just bitten by an insect or by a mosquito. And the reservoir for malaria is human beings. So for you to be infected by to have malaria, you must have been bitten by an infected mosquito that had previously bitten someone who had malaria and then infected you with the malaria. Now, in a way, that explains why in medical practice we feel malaria is overdiagnosed by people and overtreated. However, the truth is malaria does occur, and it tends to normally occur in clusters. What do we mean by it occurs in clusters? What that means is that it tends to occur in an area where someone is already infected with malaria. So, say in your household, your brother had malaria, it is most likely that you will get malaria, because if you leave the rooms open for a mosquito to come in, then it could bite your brother and then infect you subsequently with malaria. And that is how malaria tends to be spread in the communities. Now, for symptoms of malaria, what do you need to look out for to suspect that the person has malaria? So one of the main problems is that most people go to the pharmacy and say, oh, I'm having a fever and headache, and the first diagnosis will be you have malaria, go and take anti-malaria drugs. Of course, maybe 1 in 10 of these people would have malaria and to be helpful, but for those other 9 people, they've basically treated malaria when they probably did not have malaria. However, one of the problems is that also the symptoms we see in malaria is quite vague, and it could apply to other infections. This could be things like headache, fever, generalized body pains, loss of appetite, fatigue, extreme fatigue, vomiting, even sometimes stomach pains, in some cases passage of watery stool and things like that. So these symptoms, they tend to occur in other people, in other infections, and that is why it is very important, if you're having these symptoms, not just to go and treat malaria, but go to a hospital or a diagnostic facility and try as much as you can to run a blood test. Now, in terms of the progression of malaria, we have the symptoms which would occur at the initial stage, maybe between the first 3 to 7 days of malaria, which I've already previously listed. And then if left untreated, malaria can become more severe. And this will manifest as sometimes delirium. Patient tends to sleep throughout the whole day. Is so weak, loss of appetite. Sometimes you see the patient has lost a lot of weight. If we still leave this kind of situation untreated, then you start having cases of cerebral malaria where the patient starts by having seizures sometimes and then loses consciousness. Or it could manifest as anemia, whereby the person starts becoming pale, there is loss of red blood cells. And then we have damage to vital organs like the kidneys, the liver, and then heart failure. If these conditions are left unmanaged and not properly treated, it's most likely that these patients will not make it. So the severity of malaria would be determined by the volume of the parasite in the system. The higher the parasitemia level, the more severe the symptoms.
At Abdominal, we under-promise but over-deliver. We keep you ahead of the class, we make your presence perfect, and we take it to the limit. Skincare so full of equity. Abdominal is a damn asset. Now me talk. Oh yeah now.
Abdominal Skincare!
The mosquito is a carrier. Mosquito does not have malaria. The job of the mosquito is the carrier. It carries it from one reservoir to the other. And the reservoir for malaria are human beings, not mosquitoes. So the mosquito is just carrying it from one human being to the other human being. And the mosquito itself does not fall sick, doesn't have malaria. It's just doing the job of a delivery man, taking the malaria from an infected person and delivering it to an uninfected person. And that is why malaria is in an organized society is easy to manage disease once you can control, number one, the survivability of these mosquitoes by making sure that you don't have stagnant water around where they can breed. Also, there are new science and technologies out there where they can genetically modify the genes of the mosquitoes so that when they take this blood from the infected person, they cannot transfer it to someone who is not infected. So, of course, in Africa, we still have a long way to go with this, considering our environment, poor drainage, bad roads, and we are also in a tropical region where these mosquitoes, they tend to thrive. So, however, we are optimistic that in the nearest future we will achieve a significant result in terms of controlling the population of this particular breed of mosquitoes that tend to transfer malaria from one person to another. There is no proven scientific paper on that. Some people say AS patients tend to tolerate malaria better. In fact, there is a theory that AS gene mutation is as a result of malaria itself. However, there is no concrete scientific paper on those suggestions. I'm going to speak from the hospital perspective, and we know that we see AA patients break down, AS patients break down, SS patients break down, regardless of your blood group also. What matters in terms of malaria will be the parasite load in your blood. So if a patient has a very low parasite load in his or her system, he probably might have the malaria for days or weeks without breaking down. But once the parasite load starts going up, of course, the symptoms will start manifesting, regardless of his genotype or blood group. And now the second thought of some people naturally being resistant to malaria, that also is not proven. As we know, malaria is a parasitic infection, and we know that it is overdiagnosed. So we really cannot say scientifically that these people that will say that they had a fever 2 days ago and they just took paracetamol and it stopped. We really cannot say they had malaria because we did not, or we cannot say that they were diagnosed for malaria at all points. And then the last criteria will be the effectiveness of the diagnosing party. Right now, in terms of diagnosing malaria, we have the serology test, which will look for antibodies to malaria, and which is a very effective way of diagnosing malaria. And then we can as well use the microscope to view the malaria parasite on a film. Now, using the microscope is prone to human error and is prone to overdiagnosis. And that is why most hospitals now, they run these two tests simultaneously by doing the serology test and then using the microscope. And the reason why we say that it's prone to human error is because it has become a practice that most of the time somebody goes to the lab to run a malaria test. You would always see like 1+ of malaria regardless. And the question is, when you take this same person and check on a serology kit, you realize that the malaria was negative. And if you don't treat the malaria, the person gets better when you focus on what the major illness is. And based on those parameters, we feel that malaria has been overdiagnosed and should probably be properly diagnosed before treating.
Swift Dry Cleaners Limited, professional dry cleaners, best in dry cleaning and laundry services, and meets the needs of our consumers. Yeah, Swift Dry Cleaners Limited, Swift Dry Cleaners Limited, Swift Dry Cleaners Limited, Swift Dry Cleaners Limited. Yeah, for clean wash and quick delivery. Yeah, Swift Dry Cleaners Limited, Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. Swift Dry Cleaners Limited. For clean wash and quick delivery.
Swift Dry Cleaners. Clean wash, quick delivery.
So my advice for people, for patients normally, is that you should go to the lab and run a malaria test and ask them at the lab that you also want to do a serology test. This is important because it will guide you, and it relieves you of that thought that there might be human error involved in the diagnosis of malaria. So if the lab cannot offer serology test, then you can as well go to pharmacies where you can buy these malaria test kits, which are instant diagnostic kits, and you can as well do it yourself, and then you compare the result with what you got from the lab. That way, even while you're treating malaria, and if the serology kit says it's negative, you probably should start considering that you could as well be suffering from another infection or illness, and try to go for further investigations. Number one, malaria tends to be rampant in tropical regions. Malaria, the mosquito that spreads malaria cannot really survive outside certain temperatures. So it tends to exist in majorly tropical regions. And if you look at the tropical regions, most countries in tropical regions are not very economically viable. Now, in the cities, of course, there's access to diagnostics, there's access to malaria drugs, which are known to be effective. There's access to medical care. However, malaria is more lethal in the village and the countryside. And this is because most people don't have access to medical care. Traditional medical practices are very much the norm in these places. And when people are running a fever, especially young children and pregnant women, they tend to take more of herbs without actually knowing what the problem is. And this is the point where malaria becomes very lethal, because it requires just a short period to progress from a mild infection to probably highly lethal infection. And if care is not taken within this period, and these people continue taking the herbs without recourse to proper care, then the survivability is very low. The second problem is access to potent malaria therapy. As of today, the recommendation is artemisinin-based combination therapy. This is because it has been found that it is very effective against Plasmodium falciparum. Now, however, in the countryside, people still use chloroquine because it is cheap, readily available, and a lot of times malaria tends to be resistant to the chloroquine, and this also contributes largely to the mortality rate that we see with malaria in the tropical regions. So the next step will basically be, once we diagnose malaria, how do you manage malaria? As I've said, the most effective drug against malaria has always remained the same. However, this drug is mainly used to treat very severe malaria that is resistant to all other forms of treatment. It is called quinine. The problem with quinine is that it comes with its own side effect. So most doctors will not recommend quinine to anybody to take home because it comes with its own side effect, and sometimes it could be confusing. You don't know if the patient is getting better or getting worse. However, about 20-30 years ago, chloroquine was the gold standard, but over time, malaria became resistant to chloroquine, and then about 25 years ago, artemisinin was recommended by the WHO to be added to every single therapy for malaria. That's why we have artemisinin-based therapy. What this means is that, number one, you do not treat malaria with a single drug. And this is to help reduce the potential for malaria to develop resistance to these drugs. If you use a single drug to treat an infection, over time the infection, the parasite, the bacteria, the virus becomes smart and starts to develop enzymes that can block the potency of that drug. Now, what WHO recommends is a combination of at least 2 or more drugs, and that's why we have the artemisinin-based therapy. And one of these drugs has to be artemisinin. The other could be any of the other drugs combined with it. And it has been shown to be very effective in treating malaria. And also, artemether, which is an injection, is probably one of the most effective drugs in treating very severe cases of malaria, which is why we practice in Nigeria. To prevent malaria, as we said in the first place, it's very important for you to make sure that you sleep in an area devoid of insects, especially mosquitoes. Probably under the net. If you live in an area where you don't have the net on your windows, then you should probably buy insecticide treated mosquito net, which you can put above your bed. Make sure your drainage system is always covered. From time to time, try to fumigate the drainages in your area. If you live in a place where you have stagnant water pooling on your roads, these are things you might have to look at to prevent these insects habiting in the stagnant pool of water. Malaria tends to be rampant in the raining season, and this is simply because you have more water pools here and there. And once we can control these things, I'm very sure that we can bring down the number of cases of malaria in our communities. So, thanks for listening. I'm Dr. Dosunmu Jubril. Stay fit and stay healthy. Thank you.